there is somebody that even before you were thinking about the health of the GI tract. That was Hippocrates. And he said in 418 BC that all diseases begin in the gut. So there you are. Research is proving him right. Now we're going to talk about the clinical benefits. This is where the rubber hits the road. Well, so why give a probiotic? What can it do? There are a lot of studies out there about individual probiotics for an individual issue, but really we're looking for studies that are human studies, and that they're randomized, double-blind, placebo-controlled studies, and that they're meta-analysis. In other words, you've taken a whole bunch of studies, let's say on irritable bowel syndrome, where they gave a probiotic, and some of the studies may show benefit, others may not. And so meta-analysis is the power statistically to show whether or not overall there's a benefit of a probiotic for a particular disorder. So there's limitations in the studies, though, because it's not apples to apple. It's not like giving amoxicillin to see if it gets rid of a middle ear infection. You've got probiotics out there, but there's no standardization for the genus, the species, or the strain. The exact strain is not identified. The dosage, as far as how many billion in a serving size of the bacteria are you giving, will vary, and that has an impact, obviously, on the outcome. And the probiotic can be a single genus, a single species, or it can be a probiotic that has multiple genus, species, strains. So those make a difference on the outcome and the duration of therapy. So sometimes you'll hear someone say, well, I tried a probiotic, it didn't work. That doesn't mean all probiotics won't work, but that one may not have been the right one for you, and you got to look and get comfortable. Here is where probiotics in clinical studies have been shown to be beneficial. Irritable bowel syndrome, this is where they showed statistically making a difference. There isn't in medicine anything that's a home run. So even 25 to 30% is some better. But again, you realize some of them are done on probiotics that are weak, and there's other bacteria probiotics that are doing much better, but this is the overall improvement. Antibiotic-associated diarrhea, huge problem. Taking a probiotic can lessen it by that amount. C. difficile, you all are familiar with C. difficile colitis. You've heard about that, right? Big problem. So taking a probiotic, when you take an antibiotic, it's not a real major thought process, but it's certainly, if you can lessen the risk of these kinds of problems, that's a big deal. Ulcerative colitis studies are still not in to show it's a clear benefit. Pouchitis is a specific disorder. We may not talk about that. Infectious diarrhea. So in kids going to daycare centers, they give them probiotics or a placebo, and you can have a reduction of at least 34% in bouts of diarrhea, or at least lessening the risk of the duration of diarrhea. So we've been watching on television lately in the Philippines, where there's been a destruction of the whole water system, and there's no real water there, and you see these kids who are really thin, and a big problem is now diarrhea, infectious diarrhea. Well, if you can shorten the diarrhea by 24 hours, that's a big deal, because they quickly become dehydrated, and there isn't now access to health care, and they'll die. And it's a lethal problem under those circumstances. And traveler's diarrhea, which I think this is an underestimation of what the probiotic bacteria can do. It's just what studies have been done. When I started out the talk, I said medicine is driven so much by the pharmaceutical companies. So who's got the big bucks to do the studies? Well, it's the pharmaceutical companies. And so we only see a lot of the results on a few of the different probiotics that are out there. But there are a lot more products that may show better results than some of the ones that have been done. This is a typical person with irritable bowel syndrome. It's multifactorial. So, you know, when I was back doing GI, well, it's stress-related, and they've done studies and surveys. So 80% of people who have irritable bowel syndrome have a psychological issue. But if you take people off the street, a lot of people will have psychological issues. So I think that's unfair to people with irritable bowel syndrome. So, but what's really interesting, you know, we've had these outbreaks of E. coli, salmonella. Well, I think it was E. coli. They got the cantaloupe in Colorado, and people got sick, or maybe it was Campylobacter. But in any event, they've looked at point outbreaks, and people have gastroenteritis. Normally, within 6 weeks, people get better. But a third of the people can go on and have ongoing GI issues. They never reestablish their normal flora. And so they'll show up in a doctor's office somewhere, and then they get labeled irritable bowel syndrome. But it was really post-infectious irritable bowel syndrome. And again, it's fixable. Okay? So when you have an infectious process, you have this dysbiosis, you reduce the lactobacillus and bacteria. There's an ongoing chronic inflammation by the T cells. You've got release of the cytokines we talked about. There's visceral hypersensitivity. Gas distension causes a lot of discomfort because the mast cells are activated and they're releasing histamine, serotonin, and proteases, which have a lot of effect. And there's this part, serotonin. Most of the serotonin is in the gut. But the brain-gut relationship is tremendous. And there's increased luminal gas production. So we're going to reestablish with the probiotics the flora, the strength, and regulate the immune reaction, and that's beneficial of probiotics. These are studies that have shown, big studies, 1,400 people in these meta-analyses, 1,600, and it shows, this is relative risk. If you flip it around, it shows the percentage of improvement. So down here, 29% improvement with a probiotic. Antibiotic diarrhea, big problem. So all of you have taken antibiotics sometime, I suspect. Are you offered or recommended to take a probiotic once you get it? Okay. So diarrhea is associated with taking an antibiotic and occur with or afterwards. There are people that I saw in the office that took an antibiotic 3 or 4 weeks earlier, and if I didn't ask that question, I would have never made the relationship. But it can take a while until you start to see the effect of a disruption of the healthy bacteria, and then you get diarrhea. So antibiotic-associated diarrhea varies with the type of antibiotic. A Z-Pak, zithromycin, is not a big issue. It doesn't really wipe out a lot of the bacteria, but Cipro, Augmentin, a lot of the different antibiotics we use are certainly associated with the risk of antibiotic-related diarrhea. And it really is a big deal where you get this, and that's going to talk about C. difficile. So the big problem is the severity of the diarrhea is related to developing C. difficile colitis. But 5 to 40% of people taking an antibiotic will get diarrhea, and you take a probiotic, you can lessen it. And the studies have shown that it reduces it by 47% in the studies. Here's a couple of studies last year that came out. So the big problem today is that C. difficile, this is pseudomembranous colitis. This was what C. difficile colitis looks like. C. difficile is a bacteria that if you're walking around not in a hospital environment, maybe 3 or 4% will harbor it. And it can't cause any harm until you knock out the good guys, and then it grows and produces a toxin and causes a terrible colitis. But it's a real problem because it also has an inactive form called a spore. And so that when someone's in the hospital, they get on an antibiotic, they touch the bed rail where someone else has already been. The spores are not killed by alcohol. They're not cleared by a lot of the processes that are done after somebody moves out of a room to clean it for the next person. It's a really big problem in the hospital. So it's the most common acquired hospital infection, greater than 3 million infections in hospitals annually. Medicare has now come out and said that if there's a complication in the hospital because you didn't do the right thing, they're not paying. So if somebody went in for like back surgery, they have a certain amount they're going to get paid. But if they get a complication of C. difficile, it's up to the hospital and the doctors to foot that bill. It costs $35,000 to treat an episode in the hospital of C. difficile. So they're working really hard to control it. So this is a little bit more about C. difficile toxin, but what's really become a major problem, so I'm concerned about my wife. She got treated for it, but the relapse rate in general is 25% of people who get better. You take the medicine, you get all better, stools are normal, but within 6 weeks, there's a 25% relapse rate in patients. Then, if you treat them again, that subset of people, there are now 40 to 60% have recurrence of, again, kept episodes. And if somebody's older and have other underlying health issues, it becomes a real serious problem. And we're dealing with a drastic situation. So the studies have shown, here's a study in 2011. They had 7 studies where people took an antibiotic when they took the probiotic, and it reduced the risk by 71% of C. difficile colitis. Here's traveler's diarrhea. I really think this is underserved. If you're going to, I've tried to talk to passports, but anybody that's going to travel to another part of the world, that food handlers, just the system is different, you're at risk. Take a probiotic. It won't hurt you. It may help, and you don't want to ruin your trip. And here are some studies. These are older studies, but it did make a difference. So children, besides what we talked about, diarrhea, there is this atopic dermatitis, eczema. And I wanted to spend a minute or two about how the probiotics have a huge impact on the immune system. Atopic dermatitis, or eczema, is a scaly rash. We're all familiar with it. It's common. It's more common in families. There's a genetic predisposition to it. In the United States, 10 to 20% of the children have eczema, and adults 1 to 3%. But we have a lot of allergies, and what's shown is in the last 30 years there has been a tripling of asthma, eczema, and allergic rhinitis. I mean, I can't tell you how many times I recommend Flonase, or you recommend neti pots, whatever, but it's a big problem. And it really gets back to the hygiene theory. We're so sanitized now, if something drops on the floor, we throw it away. The child can't pick it up. So the allergies have been more prevalent in the developed world, more common on farms, because you got allergies prevention is better when you're living on a farm because you're exposed to a lot more bugs. And it shows that children who are the oldest, they're not exposed to their siblings' bugs, and so they have more of a risk for allergies. How this happens is that we have the Th1 and Th2 cells, so we're sanitized. So our immune system is sitting in idle position. They're not fighting parasites, they're not fighting viruses and bacteria. So there's a shift. There isn't much need for the cellular immunity, but we have the Th2 cells. They're normally fighting parasites. Well, there aren't parasites coming in, but we have a lot of food antigens, dust proteins that we inhale, ingest. So that stimulates the Th2 cells, but we have also these regulatory cells, and if they're stimulated more, that will downregulate the Th2 cells from causing an immune reaction. When you give a probiotic, you stimulate the regulatory cells, and it will lessen the risk of having eczema. Here is a study where they gave mothers in the last trimester of pregnancy probiotics, and then they gave the children for the first 6 months a probiotic, and they looked at 2 years, and there was a reduction of eczema in the children that received the probiotic by 21%. Newer studies have shown benefit up to 60% in lessening the immune reactions. So I talked about the plasma lipids. These are just other things that probiotics do. I talked about vaginal yeast infection, but urinary tract infections in the women's anatomy is such that they're constantly being bathed or close to being bathed in the intestinal bacteria, so it's easy for E. coli to cause a black cystitis. And the studies have shown if you give a probiotic, the probiotic bacteria create a biofilm that prevents the E. coli from getting into the urethra and causing a problem. This is a problem in ammonia when you have liver damage, and probiotics help to lessen the ammonia. Non-alcoholic fatty liver disease is a major problem for us because we have such a problem with obesity in the United States. The cells of the liver become stuffed with fat, and that causes inflammation, and we get a terrible hepatitis, and it's becoming the most common cause of cirrhosis in the United States. This is really, if you've all had children, the infantile colic, it's a rule of 3. It occurs during the first 3 months of life. Cry time is, the definition is cry time for more than 3 hours a day or more. It occurs 3 days per week or more, and it lasts for 3 weeks or more. So if you're a new parent and your child's chronically crying, then you first of all go to the pediatrician to make sure there's nothing serious. The child is checked out, and the diagnosis is infantile colic. Well, for years, the only thing the pediatrician would recommend is to buy simethicone drops and give it to the child. Well, I just said it doesn't do anything. It treats the parent. But they've done studies using probiotics in these children, and what they found was that it resulted in a 50% reduction in cry time. So it's a good thing to know. In flu, they've done studies around the world. There was one big study done in China where children that were going to daycare centers either got a probiotic or a placebo during the cold and flu season, and 70% reduction in symptoms of cold and flu. So you really have to think that part of the immune system is now affecting the respiratory tract also.